Welcome to the Daily Current Affairs by CivicCentre IAS, where we try to discuss the important articles from the Hindu, the Indian Express, and the PIB from the UPSC CSC Prelims perspective. Displayed are the list of articles which we are going to discuss in today's video. The first article of the day says that, in alignment with its commitment to accelerate the achievement of Sustainable Development Goals related to TB elimination, the Union Minister of Health and Family Welfare, Shri J.P. Nadda, announced several key initiatives aimed at enhancing nutrition support for TB patients and their household contacts. In this context, let us talk about two schemes related to it. Firstly, talking about Ni-Kshay Poshan Yojana. See, Ni-Kshay TB notification incentive for private sector scheme is a Government of India initiative to incentivize private sector healthcare providers for notifying TB cases to the government. Know that the scheme was launched in the year 2018 and is implemented by the Ministry of Health and Family Welfare. Significantly, the Ni-Kshay scheme is an important step towards improving TB notification rates in India. And furthermore, TB notification is critical for TB control and prevention efforts. Also, it helps to ensure that TB patients are identified and treated promptly and their contacts are traced and screened for TB. Then, what are the benefits under the scheme? So, financial incentive of 500 rupees per month for each notified TB patient for duration for which the patient is on anti-TB treatment. But now this was increased from 500 rupees to 1000 rupees per month for the entire treatment duration. Talking about its eligibility, see, all patients with TB who are notified to the government on or after April 1st of 2018, including those who are already being treated for TB, are eligible for financial incentives. Furthermore, to be eligible for the incentives, patients must be registered or notified on the Ni-Kshay portal. Moving on to talk about the Pradhan Mantri TB Mukt Bharat Abhiyan, see, the Ministry of Health and Family Welfare is implementing an ambitious national strategic plan with a goal to achieve SDG and TB targets by 2025. So, for effective management of the community in the path towards ending TB in India, the ministry is implementing the community support to TB patients, which is the Pradhan Mantri TB Mukt Bharat Abhiyan. If we have to talk about the objectives, firstly, to provide additional patient support to improve treatment outcomes of TB patients. Secondly, to augment community involvement in meeting India's commitment to end TB by 2025. And lastly, to leverage corporate social responsibility activities. The second article of the day says that the tap water reaches 78.58% of the rural households under Jal Jeevan Mission. In this context, let us talk about Jal Jeevan Mission. See, the scheme was launched by Prime Minister Narendra Modi on August 15th of 2019 with the ambitious goal of providing tap water supply to every rural household by 2024. So, at the time of its inception, only 3.23 crore of the rural households had tap water connections. Significantly, the mission aims to bridge this gap by providing nearly 16 crore additional households with tap water by 2024, ensuring the functionality of existing water supply systems and directly benefiting over 19 crore rural families. Furthermore, this initiative is intended to reduce the rural-urban divide and enhance public health. Know that the mission is based on a community approach to water and will include extensive information, education and communication as a key component. Notably, Jal Jeevan Mission looks to create a Jan Andolan for water, thereby making it everybody's priority. If we have to look at its key achievements, see, as of October 6 of 2024, Jal Jeevan Mission has successfully provided tap water connections to 11.95 crore additional rural households, bringing the total coverage to more than 15.19 crore households, which accounts for 78.58% of all rural households in India. Significantly, the mission has reached a significant milestone, profoundly impacting the lives of rural people by providing them with reliable access to potable water in their homes. Here are the broad objectives of the mission. You can have a look. The third article of the day says that the Union Minister Shivraj Singh Chauhan, the Bharatiya Janata Party's in charge of the Jharkhand election on Monday, said that the party would prepare a national register of citizens in the state if voted to power. In this context, let us talk about NRC. So, what is NRC? See, the National Register of Citizens is a register containing names of all genuine Indian citizens. Notably, at present, only Assam has such a register. Furthermore, the exercise may be extended to other states as well. Know that Nagaland is already creating a similar database known as the Register of Indigenous Inhabitants. Significantly, the center is planning to create a national population register which will contain demographic and biometric details of citizens. Then, what is NRC in Assam? See, the NRC in Assam is basically a list of Indian citizens living in the state. Know that the Citizens Register sets out to identify foreign nationals in the state that borders Bangladesh. Furthermore, the process to update the register began following a Supreme Court order in 2013, with the state's nearly 33 million people having to prove that they were the Indian nationals prior to 24th March of 1971. Notably, the updated FIRE NRC was released with over 1.9 million applicants failing to make it to the list. If we have to talk about the 1951 NRC in Assam, see, NRC for Indian citizens in Assam was first created in 1951. Furthermore, Manipur and Tripura were also granted permission to create their own NRCs, but it never materialized. Know that the reason behind the move was to identify Indian citizens in Assam and unabated migration from East Pakistan, which is now Bangladesh. Also, the list comprised of those who lived in India on Jan 26th of 1950 or were born in India or had parents who were born in India or had been living in India for at least 5 years before 26 January 1950 cutoff. The next article says that India has initiated discussions with the UAE, which is the fourth largest foreign investor in the country in 2023, with a foreign direct investment of $3.5 billion to scale up its commitment to invest $75 billion in the country to $100 billion. Commerce and Industry Minister Piyush Goyal said on Monday. In this context, let us talk about foreign direct investment, in short called the FDI. See, a FDI is an investment made by a firm or individual in one country into the business interests located in the other country. See, FDI lets an investor purchase a direct business interest in a foreign country. Know that investors can make FDI in a number of ways. Some common ones include establishing a subsidiary in another country, acquiring or merging with an existing foreign company, or starting a joint venture partnership with a foreign company. Apart from being a critical driver of economic growth, FDI has been a major non-debt financial resource for the economic development of India. But these are the prohibited areas under FDI. Now, talking about the countries, Mauritius, Singapore, USA, Netherlands, and Japan emerge as the top 5 countries for FDI equity inflows into India during the financial year 2023-24. Then, top 5 states receiving the highest FDI equity inflow during this year are Maharashtra, Karnataka, Gujarat, Delhi, and Tamil Nadu. The next article says that the 2024 Nobel Prize for Physiology or Medicine has been awarded to Victor Ambrose and Gary Rukwan for their discovery of microRNA and its role in post-transcriptional genome regulation. Significantly, this groundbreaking work has revealed a new principle of gene regulation essential for multicellular organisms, including the humans, with the human genome coding for over 1,000 microRNAs. So, what is a microRNA? See, the information stored within our chromosomes can be likened to an instruction manual for all cells in our body. So, every cell contains the same chromosomes. So, every cell contains exactly the same set of genes and exactly same set of instructions. Yet, different cell types such as the muscle and nerve cells have very distinct characteristics. Then, how do these differences arise? The answer lies in the gene regulation, which allows each cell to select only the relevant instructions. Notably, this ensures that only the correct set of genes is active in each cell type. So, Victor Ambrose and Gary Ruvkun were interested in how different cell types develop. Hence, they discovered microRNA, a new class of tiny RNA molecules that play a crucial role in gene regulation. Significantly, their groundbreaking discovery revealed a completely new principle of gene regulation that turned out to be essential for multicellular organisms including humans. Notably, it is now known that the human genome codes for over 1,000 microRNAs. So, their surprising discovery revealed an entirely new dimension to gene regulation. Know that microRNAs are proving to be fundamentally important for how organisms develop and function. The next article says that Chief Minister A. Revanth Reddy has urged the central government to include the state's capital's comprehensive sewage master plan under AMRUT 2.0, considering it as a special project under the scheme. In this context, let us talk about AMRUT 2.0. See, the Atal Mission for Rejuvenation and Urban Transformation, in short called the AMRUT 2.0, was launched in October 2021 for a 5-year period. Know that AMRUT 2.0 was aimed at making cities water secure and providing functional water tap connections to all households in all statutory towns. Significantly, ambitious targets were set up such as providing 100% sewage management in 500 AMRUT cities. Notably, the scheme has a total outlay of 2,99,000 crore rupees, including 76,760 crore rupees as central assistance. Know that in Puducherry, 24 projects worth 60.52 crore rupees have been undertaken, with 15 projects completed and ongoing efforts to complete the rest. Also, 44.09 crore rupees has been released for implementation. The last article of the day says that India has launched the world's largest publicly funded health assurance scheme, the Ayushman Bharat Pradhan Mantri Jan Arogya Yojana, said the Health Minister J.P. Nadda on Monday. Know that the scheme covers over 120 million families, providing an annual hospitalization benefit of 6,000 rupees per family. In this context, let us talk about the scheme and key developments under it. See, in a significant move, the Union Cabinet approved a major expansion of the Ayushman Bharat Pradhan Mantri Jan Arogya Yojana, in short called the ABPMJAY, on September 11th of 2024. Under this decision, all senior citizens aged 70 and above will receive health coverage regardless of their income. Furthermore, this expansion is set to benefit around 4.5 crore families, including 6 crore senior citizens, by providing them with a free health insurance coverage of up to 5 lakh rupees per family. So, with this approval, every senior citizen in this age group will have access to the scheme's benefits, regardless of their socio-economic status. So, if we have to look at the key new developments, firstly, eligible senior citizens aged 70 and above will receive a new distinct card under the ABPMJAY scheme. Secondly, senior residents within the families already covered by the scheme will receive an additional top-up cover up to 5 lakh rupees per year. Furthermore, this top-up will be for them and they will not have to share it with other family members under the age of 70. Thirdly, senior citizens who are not part of an existing scheme family coverage will be provided with a cover of up to 5 lakh rupees per year on a family basis. Then additionally, senior citizens who are already benefiting from other public health insurance scheme like the Central Government Health Scheme, Ex-Serviceman Contributory Health Scheme or Ayushman Central Armed Force Scheme have the option to either continue with their current scheme or opt for Ayushman Bharat Pradhan Mantri Jan Arogya Yojana. Lastly, senior citizens who are covered by the private health insurance policies or the employees' state insurance scheme are also eligible to benefit from the Ayushman Bharat PMJAY. If you have to read further about the scheme, you can check out the notes posted on our Telegram channel. So in this video, we have discussed 7 articles in total for today. We'll be back again with another video tomorrow. Thank you.